Ladies and gentlemen, please make your way to your seats. Next up is Philanthropy, Shaping the Future of Health Outcomes. And your panelists for this one will be Mr. Milton Little, Miss Christy Klein Davis, Mr. Marcus Ruzek, and Miss Jocelyn Baker.
Am I on? Now I'm on. Good morning, everybody, and how are you today? My name is Jocelyn Baker, and I have the honor and the privilege of serving Grady Health System as president of our foundation. And am thrilled to be with you this morning. Thrilled to see so many people here interested in talking about how we can affect change through philanthropy. You know, I think Grady in and of itself is a great example of philanthropy making an impact on our community. We think a lot about when Grady had its troubles and was saved and those really big gifts that came in to keep us open, but what we don't talk as much about are the hundreds of gifts every year that are allowing us to provide breast cancer screening or allowing us to feed our patients who are food insecure, really allowing us to be a pillar for equity and access to care in the community. And while we do receive government support, a lot of what we do is really driven by philanthropy, and I have to say thank you to these three panelists that I'm here with today, because each of their organizations has played and continues to play a really important role in our hospital. So I'm going to start out by saying thank you on behalf of everybody at Grady. I'm going to let our three panelists self-introduce. They will do, not that I couldn't do an eloquent job, but I've asked everybody to introduce themselves and talk not just their title, but a little bit about their role here in the community, and we'll get our conversation started. So Milton, let's start with you.
Thank you. Good morning, everyone. My name is Milton Little. I'm the president and CEO of United Way of Greater Atlanta. I've been in this role 15 years. Just to explain in a way that many of you will understand, like a lot of people who are attending this meeting today, United Way is a capital aggregator, and we're also an investor. The capital that we raise comes from individuals, whether they be high net worth individuals or truck drivers, people in supermarkets who donate through a United Way workplace campaign. We also raise money from private foundations, family foundations, corporate foundations. And our investment strategy is to find high impact solutions that address the social determinants of health, social determinants of education, social determinants of income insecurity, the social determinants of food insecurity. That's the work that we do.
Christy?
Sure. Hi, everyone. I'm Christy Klein Davis. I'm with Healthcare Georgia Foundation, and I have been with this foundation for 3 months. I have worked in the field of philanthropy for about 15 years now. And Healthcare Georgia Foundation, we're a private foundation, so we do all of our work off of our own endowment. And our work is solely focused on advancing health equity in Georgia. A lot of what we're talking about here today surrounds great innovations and really incredible things that are happening across our state in terms of healthcare technology. We also know that there's a lot of people across our state who can't get antibiotics if they have strep throat. So our goal is to close that gap. That's what we're working to do. We work in urban communities, we work in rural communities, everywhere in between, with a sole focus on really changing those conditions so that we can give everybody access to a happy, healthy life.
Thank you so much. Marcus?
Hi, my name is Marcus Ruzek. I'm the Senior Program Director at the Marcus Foundation. My name is coincidental, so I am not the Marcus, and if you came here to meet him, I apologize, you've been let down. But I've been at the Marcus Foundation for about 8.5 years. Obviously, the Marcus is Bernie Marcus, co-founder of the Home Depot, and Bernie is just an incredible man, an amazing philanthropist. We're going to talk a little bit about some of his work and the things he's done over the years. The Marcus Foundation is not exclusively a healthcare or medical foundation. However, it does comprise more than 30% of the foundation's giving. And it's a very, very big and important focus for Bernie. A lot of people don't know this. Bernie actually got into Harvard Medical School. And at the time, however, they had a quota for Jews. And so he would have had to scrape together over $10,000 to be able to pay to get into Harvard Medical School. And so he never was able to go to medical school, but he always wanted to be a doctor. We jokingly tell him, oh, you could have gone to Harvard and you could have been a doctor. You could have been somebody, Bernie. But he says now, he sells hammers. He was a pharmacist first and fell in love with the retail side, and then obviously grew the Home Depot, and the rest is kind of history. So he cares very, very deeply about medicine, about making it accessible to everybody out there, great innovations, and we'll talk more about it today. But that's kind of a quick over of the Marcus Foundation.
Thank you, Marcus. You stole my joke. So I was going to talk about how I thought you were the one who our emergency center was named after. But anyway, you got ahead of me there.
My kids are confused because they see my name on a lot of buildings around here. So.
But so you do work for the Marcus, and so many of us have been blessed by Bernie Marcus investments in different ways. And I'd love to start with our conversation with you. Certainly again. Our organization, Grady, has experienced great things because of Mr. Marcus's philanthropy. But can you share a little more? I know that when we prepared for this panel, you shared with me some things I don't think everybody's as aware of, where Mr. Marcus, because of his power and wealth, has really been able to affect change and be a convener on some really important issues.
Yeah, thank you, Jocelyn. I think Bernie, actually a couple of years ago, we were celebrating the 30th anniversary of the foundation, of Bernie's, significant grant making. And he really boiled down everything that the foundation does. We have 5 giving areas. If I go through that, it's kind of a spiel and it's a bit complex. But he said, when he boiled it down, our mission at the Marcus Foundation is to save lives and make people's lives better. And when you really look at that, just taking a snapshot of Atlanta, we're a national foundation, but looking at Atlanta alone, saving lives, whether that's in the Marcus Stroke Center at Grady or the Trauma and Emergency Center at Grady, whether that's at the Marcus Heart and Valve Center at Piedmont, CHOA, the Shepherd Center, after a terrible accident, you're getting rehab and people's lives are completely altered. The work that we've been able to do and Bernie's invested in at Shepherd Center over the years is absolutely incredible. Cutting edge medical research is something that Bernie's been doing for a long time. He's also somebody who's been a long-term believer in integrative health and an alternative and new approaches. Bernie was one of the first people to really start investing deeply in stem cell research and still does that today. What the Georgia Tech Nanotechnology Center is doing around stem cells is all about, if this is the future of medicine, then how do we make it and manufacture it in such a way so that we get ahead of everybody else and we make it accessible and not out of reach for everybody who may need it. And I think one of the biggest stories on healthcare that Bernie's been involved in is really around autism. So in the 80s, Bernie had an associate at the Home Depot who had a child with autism, and he was experiencing these struggles as the company was growing and seeing this family go through it. And realized nobody even knew what autism was, and somebody needed to start educating folks on this. They put a couple trailers together on Emory's campus. They started the Marcus Autism Center, which today is treating more children with autism than any other center in the country. It's also been just an incredible foundation and proving ground for great research. They founded a new eye tracking device there, which is now being developed. And it's been FDA approved, and it can identify autism in children as young as 6 months of age. Think of the game changer that creates. If you have a child with autism, the status quo before them would be until they're beginning to get socially active, you don't really understand or able to diagnose it. What we do know is the sooner that you can begin to intervene with therapies, the more functional and capable they're going to be throughout their life. And so this device is really world-changing. And then in getting involved in that work, he realized nobody knew what autism was. And so he was friends with Bob and Suzanne Wright, and they were also touched by autism. And Bernie said, you guys got to lead an organization and make people aware. And they said, no, it'll cost too much money. How much? Whatever. Bernie writes the check, and Autism Speaks is created, right? And look at what that has done. We all know now that 1 in 68 children are born with autism. We know that this is a thing. The world lights up blue because of Autism Speaks. And that's the way Bernie thinks. He sees a problem, he's an entrepreneur, and he goes after it. I can't say enough about that and kind of the impact that he has. But saving lives and making people's lives better is where his heart is.
Thank Mr. Marcus on behalf of all of us for all he's done. I think it's easy to get our heads around someone with that kind of platform, with that kind of respect, with that kind of wealth, has an idea can bring that idea to reality. You know, Christy, while you're new to Atlanta, you are not new to philanthropy. You're not new to the healthcare arena. I think it's important we talk about, you know, smaller organizations and individuals can have big impact too. And I'd love for you to talk a little bit about that.
Sure. So, I mean, the public view of philanthropy, if you ask someone in the public, what do foundations do, what does philanthropy do, I think the model that people pretty quickly bring up in their mind is they write grants, or they make grants. They give money. They start really, really great projects. And when that's your model, having a lot of wealth is absolutely what allows you to make a big impact. But I think it's important to shift that public view of what foundations are and what foundations do, and recognize that, you know, every foundation is different. When you look at the founding documents of Healthcare Georgia Foundation, it doesn't say we will make grants. It says we'll make change, and it says we'll make change that advances health equity. And there's issues where, for a lot of issues, lack of money is the problem, but for other issues, there's plenty of money. It's not lack of money, it's not lack of wealth, it's not lack of resources, it's lack of coordination. It's lack of people working together. It's lack of being able to get things to the right people at the right time, in the right place, and in the right way. And I think that that's also a role that foundations and philanthropy can play. When we think about philanthropy, it's an ecosystem. So we have people like, I mean, I'm flanked, right? Milton over here and Marcus over here, who have these big, beautiful yachts, and they're very expensive, and they're very nice, and they can drive around the ocean and do these really cool things. And like, we're more of a speedboat, so we can get into the little channels, we can go around the edges, and really think about where are those places and spaces where it's not that we need a huge investment in private resources, but really, where are those places and spaces where you can use some smaller dollars or think creatively about raising public awareness. You know, supporting the data analysis that allows some of these people to make some of those big investments, or allows government to make big investments that really get the money to the right place at the right time, again, to get services to people that need them. So if we think about philanthropy as an ecosystem, we need to be working together, all of us, to think about what are the problems we're looking to solve together, what can Marcus do that I can't do, and what can I do that Marcus can't do, and make sure that we're coordinating our resources in a way that kind of tackles the problems holistically.
Would you agree partnerships, Christy, have become more and more important, and that collaboration of individuals or organizations sharing that same common goal, to come together to solve issues, as opposed to one person or one organization needing to bear the whole responsibility?
Yes. Yes is the short answer. And philanthropy has to work together. Philanthropy had for a long time, we liked to tell nonprofits we worked with that they should collaborate. And then we looked at ourselves and we're like, maybe we should do that too. But it also goes cross sectors. So we also have to be thinking about, what's the business community's role in this? What is our role? What's the nonprofit role? What's the advocacy community role? We all have a role to play in bringing solutions to bear on the challenges that we face in our state, in our country, and really helping to get all those ideas to the table so that the best ones can surface, I think is a critical role for philanthropy.
Thank you. And Milton, I think you certainly represent an organization very well known, not only for bringing people and organizations together, but doing so with really phenomenal success over the years. And I'd love for you to share, you mentioned your work around social determinants of health, which really covers so much of what the United Way does. What would you point to as some of your biggest achievements that have resulted from convening those individuals and organizations?
Well, thank you for that question. In 2015, our board took a look at the Atlanta landscape and was troubled by what it saw. We had the highest rate of income inequality in the country. We had the lowest rate of social and economic mobility for poor children in the country. We'd had the fastest rate of growth of poverty in the suburbs over a 10-year span. And so they said that the traditional work that United Way had done of raising money in workplaces from employees and then investing in a broad range of nonprofit organizations was insufficient strategy to deal with those challenges. And so we began to focus. We identified that there were 500,000 children in greater Atlanta who were living in communities of low child well-being. And so we created a couple of strategies. One built an index that would identify down to the zip code how children fared on 14 different indicators. We then also mapped the region and could then decide where to be most intentional about investment strategies that would strike at the heart of the things that were creating the education, health, and wealth and income disparities. And so what we began to do was really focus in the health space, particularly on what we could do. We were not going to be building a hospital. We were not going to be doing some of that audacious and incredibly important and powerful work. But what we could do was help hospitals solve workforce challenges. We could help them build in-house training programs that took folks who were in maintenance, had the skills and capability to move up, but there was no internal strategy within those hospitals to grow people's skills and then move them up into more challenging jobs and jobs that had career paths and higher income possibilities. So we built those strategies and partnered with hospitals to do that. We also created community health workers strategies, lay people from communities who could serve as patient navigators in Grady and a host of other hospitals to help ordinary folk who just may not have the language proficiency or other experiences know how to make their way through a hospital. I've got a master's degree and I still get confused when I walk into a whole lot of hospitals, whether it's about following the blue arrow until it turns orange and make my way to this room, or just what is the doctor saying when they are explaining to me what my ailing mother has to deal with. And so we created a strategy to deal with those things. We also helped put into public schools healthcare workers, because in many cases it was the school nurse or the school that was identifying child abuse issues and a host of other things. And so we created partnerships with a host of organizations that would help address those things. So Jocelyn, it was really about, as was just said, where can we be most surgical in what we do? I don't know that we've got a yacht. I've got much more of a lumbering aircraft carrier. And we try to figure out how to navigate that as we transition the organization from what it has always been and most recognized for to something that's really striking the heart at the issues that consign poor kids in Atlanta to poverty when they die, and that ought not be the promise we make to any poor child, that if you're born poor, you're going to die poor. We're determined to solve that problem.
So following on the boat analogy, Milton, so
She started it.
I know, but you picked it up, so I'm going to pick it up too. We're gonna learn a lot about nautical issues here. No, but in all seriousness, we've all been in those situations where we're all trying to get to the same port at the end of the day, but somebody thinks we need a motor, somebody thinks we need sails, somebody thinks we need a ship that carries 50 people. Other people think maybe a canoe's the best way to get there. Okay, I'm done with boats now. But in all seriousness, no. So I think the challenge with collaboration, and sometimes where collaboration fails, is we're all very beholden to our specific idea of what success looked like and how we need to get there. So how do you work through that at the United Way? Because I'm sure you've got leaders you're working with, you've got donors you're working with, all well-intended, all trying to get to the same goal at the end of the day, but with very different perspectives as to how to do it.
Well, we do it because we've always been an intermediary. I mean, we're not a direct service organization, so we depend on organizations that can deliver services to the end user. We can't raise enough money to solve the problem, so I've got to have a partnership with the Marcus Foundation, with Woodruff, with everybody else that's committed to these issues. I've got to have a partnership with policymakers, because at the end of the day, as Winston Churchill said, you've got to instill in policy what you try to solve through charity. And so you've got to have policymakers that will pick up the innovations that you test and demonstrate to be effective to make them part of how systems work. So it has always been the role of United Way to be at the intersection of the institutional players, individuals that want to make a difference, but also at the intersection of what is most concerning about the community and what's in the best interest of people trying to use their philanthropy in the best way possible to have impact.
Thank you, Milton. You mentioned policy, and certainly there is no shortage of discussion or debate around a lot of healthcare-related policy matters today, issues that touch within social determinants of health. We talk so much in Atlanta now around homelessness and how that really does drive health outcomes, food deserts, so all these things that really, to your point, none of us can go in there and build it and fix it. It comes to what's our philosophy from the beginning. Christy, you've had a lot of experience in the policy arena, and I'd love for you to talk a little bit about kind of the policy piece of this and why, for those who are interested in impacting change, keeping that policy piece at the forefront is so important. And for those who are philanthropists or those who are interested in investing in an organization, how can philanthropy make an impact and help bring some of that change about that we really need?
Sure. So yeah, I think there's a lot of ways. So I'll speak to kind of what I've done and where I think foundations can have a large impact. But just start by saying we need to keep in mind that yes, policy happens in Washington D.C. and yes, policy happens under the dome here in Atlanta. But policy also happens in every single city hall across the state, in every school board meeting. I am a recovering school board member, so I know that, and in hospital boardrooms. So when we talk about policy, we're not just talking about kind of state and federal policy, we're also talking about policies within organizations, within institutions. And I think regardless of what level we're speaking at, the rooms where policies are developed and enacted, they do not lack ego. You've got a lot of people in those rooms who are smart, who are well-intentioned, and who also think that their idea is absolutely the best idea that has ever existed around that particular issue. And if you take any issue, we know that politicians have ideas on what should happen, maybe more than one idea on what should happen. Providers, be they doctors, teachers, nonprofits, they have ideas. Academicians have ideas. The business community has ideas. And the humans being impacted by whatever we're talking about have ideas. And the simple truth is that the best policies will come about when all of those people are able to come into a room, have their ideas shared, and come work together, collaborate, partner, to make sure that every angle is heard and that the best solution emerges from that. So I think that one of the things that foundations can do and philanthropy can do is create conditions for those tables to be set and for those rooms to be places where people can go to, where people can drop their egos at the door and hear each other. And that can look a lot of different ways. Sometimes we spend some money just getting a room and buying people some sandwiches, and that's good enough. Other times we might pay for some facilitation. Other times we might have to referee a little bit to make sure that people's voices are being heard. But that convener and moderator role is one I think philanthropy can play well. And I would specifically name, one of the things philanthropy can do is make sure that that human being that will be affected is absolutely at the center of those discussions. And I think philanthropy can look around the room and see who's missing and name who's missing and work to get that perspective to the table. If we're sitting here in Atlanta and we're talking about some statewide policy and we look around and everybody in the room is from Atlanta, that policy isn't going to work in the rural corners of our state. So we can look around and say, okay, how do we get that at the table? We're talking a lot, and I think it's great, about maternal mortality and the fact that the rates are too high, and new research from the CDC says that 4 out of 5 of those deaths are absolutely preventable. If we're talking about that, and we look around the room, we know there's enormous racial disparities in our maternal mortality rates. If we do not have black women, black moms at those tables, we're not doing it right. So one of the roles that philanthropy can play is making sure that those voices are there so that we get the right solutions uplifted and can work to get that known publicly, to get public engaged around it, and to help the people who are ultimately in the chairs that get to make the policy decisions, make ones that will actually work for everybody.
Thank you, Christy. And so Marcus and Milton, I'm going to ask you guys to address this next question from two different perspectives. I think Marcus from a national perspective, given where you sit, and Milton from our state and local perspective. You know, one of the challenges with affecting change in healthcare is it's hard. It affects human beings. It's hard. It's not just a kitchen table issue. It's an every room in the house issue, and sometimes that's a barrier. But over the past 2 years, you know, we have seen a pandemic that people who know me have heard me talk about that as equalizer. That touched everyone, no matter race, gender, income level, where you lived in the world. We've seen so much more attention to equity and access and racial disparity. Do you think we're at a time and place where there's a willingness to do that hard work right now, so that if those who are interested in affecting change in care, is this a good time to engage? And again, Marcus, I'd love your thoughts from a national perspective, and Milton, I'd love for you to speak to that with regard to kind of here in Georgia and Atlanta.
Sure. Thank you, Jocelyn. I mean, I think that the time has probably been a long time coming to really address a lot of those issues. I think if you look at our population as a whole, and you talk about healthcare change being hard, especially when it comes to policy, look no further than the Veterans Administration. It's the largest health system in the country, and it's one that is not doing a great job for our veterans. I'm an Army veteran myself. I say that as a VA patient. I also say it as someone who's been working for 8.5 years and working on veterans health care. And when we look at different populations across the country, our veterans are a great example of our nation. They're like the perfect cross-section. They really are America, just Americans that served. And I really think that's a very, very good population and place to start. And I'd love to talk at some point a little bit about what we're doing for veterans. I mean, the veteran suicide epidemic is a real thing. Over 20 veterans are killing themselves every day in this country. And that's VA data. The fact of the matter is there's about 19 million veterans in this country. The VA only knows about 11 million of them, so a little more than half. And states and counties underreport veteran deaths at around 25%. And so this epidemic is actually far worse than we believe. If you start to add in, there's a study that came out this week, if you start to add in self-injury mortality, things that are not classified as suicide, the number of veterans that are dying young gets closer to 40 to 44 a day. I mean, let that sink in. 40 to 44 a day. I really do not think there is enough focus on that issue. And one of the things that's really important about veterans is they tend to be a notification or a marker of what's coming in the general population. And I really think this is something we got to zero in on and get right in a population that is all of America in one place, so that the general population and everybody can be better. So I think that's one place to start.
And Milton, before you speak, I think, Marcus, how would people get engaged with that issue? I mean, I think you've presented some really compelling information, something so important, supporting those who've served our country and continue to. What advice would you give this room if that's an issue they'd like to get involved with? Yeah,
it's a great point. I mean, when you look at veterans dying young, this younger generation of veterans, which I'm a member of, the Global War on Terrorism, we had 20 years of war. It's the longest sustained military conflict in our nation's history. And it was fought by all volunteers, which is truly an incredible thing. I mean, to think about the era that we live in today and the fact that less than 1% of our population just raised their hand and volunteered to serve. But there's a lot of misnomers and misconceptions that come out of that. A lot of people think, oh, well, veterans, we sent over 3 million veterans to war over the last 20 years. They saw a bunch of terrible things. They did a bunch of terrible things. They came home. They all have PTSD, and so they're a little messed up. And the fact of the matter is that's just simply not the case. If you really boil the data down, there are 3 main factors that are leading to veteran suicide. Major depression is number 1. Substance abuse and addiction is the second. Over 70% of veterans who take their own lives are either drunk or high when they do it. And the third, which is somewhat debated, but miss or undiagnosed traumatic brain injuries, which are running prevalent in our veteran population. And not just our veterans, because there are over 4.5 million TBIs in this country every year. And go to any one of these hospitals, one of these great systems, and you have a TBI, and then you're part of the 10% that have persistent symptoms, there's not a lot of treatment out there. Quite frankly, it's just simply something that has been ignored in healthcare. And so as our veterans are acutely struggling with these issues, Bernie and the Marcus Foundation, we took an approach to go very narrow and deep into this problem, and specifically traumatic brain injury clinics. We've got a program here at the Shepherd Center called SHARE, a military initiative, which was something started over 10 years ago that has yielded incredible results. And we've since launched that and kind of replicated that into 6 different clinics around the country and growing. And then we also found that traditional mental health just wasn't working for veterans. Actually, when a veteran enrolls in and attends their first session at the VA in traditional mental health, their likelihood of suicide actually increases. So the traditional mental health system is simply not getting it done. So we looked at other ways, and we found a great training program that's wellness-based, that's focused on the science of post-traumatic growth, and how we can train veterans to be stronger because of what they've been through and not just diagnosed and weaker. And we've proven over 1,800 veterans an average of 56% decrease in their post-traumatic stress, 40 to 60% decreases in depression, stress, insomnia, anxiety. Very, very exciting stuff. And this isn't a healthcare program. This is a training program. And so Bernie has brought these together in one movement called the Avalon Network, and we're replicating and scaling it around the country. And the fact of the matter is, yes, Bernie has a lot of resources. But if he gave every penny that he had, it would still be a drop in the bucket of the VA's annual budget, $300 billion a year. So to Milton's point, philanthropy can do incredible things with large gifts. But if it's only, the idea should be that philanthropy proves a model and proves a better way, and then policy changes because of it. So I think this is a great example of how.
Thank you, Marcus. And so, again, Milton, would love your thoughts on, do you think there's more appetite for real change here in our community? And I'm going to go ahead and add to that question. What do you think are some of the biggest fires we should be focused on right now, should that appetite be there?
Well, again, thanks for that. I hope, my answer is I hope so. The 2008 recession was a great equalizer, and we got past that, and we went back to living life the way we used to. The pandemic exposed disparities that had long persisted, that long existed, long recognized by folks. The index we put in 2018 predicted in the early days of the pandemic which communities were going to be hit first, hardest, and most dramatically. And that's how we invested $30 million that we had raised with the Community Foundation in 8 weeks. To address those issues. As human beings, we rush to solve a crisis, but we let linger, the daily crisis, the daily high unemployment rates in communities, the fact that poor schools have existed in some zip codes forever and we haven't figured out what to do. I remain persistently optimistic that we're going to get it right. But it's not going to be done by itself. It's going to take the concerted effort of folks like this, folks in the audience, who are going to say that, here's the line, and we're not going any further. We're not going to allow these disparities to continue to persist. And to your question about what the burning fires are, they are everything associated with race and place. And we have to acknowledge, we've got to acknowledge race-based disparities, we've got to acknowledge place-based disparities, and we've got to solve for those issues. We've got to be able to have an uncomfortable conversation about the implications of race in policy, big policy, DC, state capitals, and little policy. Who do I hire? Where do I recruit from? How do I promote folks within my company, within my organization? It's at all of those levels that we've got to bring attention to so that the lessons from the pandemic don't dissipate in our desire to get back to the old normal, which wasn't working for 80% of poor folks in Atlanta.
Thank you. That's poignant and a lot for us all to think about, Milton. And again, thank you for all that you do. We've been tasked with getting the conference back on time, so we have just another minute or two. I would like just quickly. I'm going to. Most of the folks who are sitting in this room today are here because they If you're in a conversation around philanthropy, that means you're somebody who understands impact and wants to make a change. And just quickly, Milton will kick with you, and we've touched on this some. Kind of, what's the one piece of advice you would give somebody here in this room today that really wants through their company, through their church, or individually want to make a change?
I would say that get in the game. I mean, you know, it's that simple. Many people don't think they're smart enough to make the right investment in philanthropy, that they don't have enough money to make a difference, that they don't have enough time to volunteer. The real issue is all of us have to get off the sidelines and get in the game, and the collective power that the collective has is what's going to make a difference. So just please get involved and stay in the game.
Christy?
I think the thing I would add to that is, you know, get in the game is, yes, with our dollars, but get in the game is also with our voices. And when there are things that we see that are wrong and that should change, we have to be willing to be courageous and have those conversations with our neighbors, with our family members, with our elected officials, and be able to also, if we are ones who have the privilege of having a microphone in front of us, make sure that we hand that microphone over to someone else and make sure that we make space so that other voices can also be at the table and be heard, because that's also key to making some of the changes we want to see.
Thank you, Marcus.
Yeah, I emphasize exclamation points on both those. And I think also when you enter the game, be creative. You know, look outside the norm. I think that what we're seeing in traumatic brain injury, for example, our clinics are doing incredible life-saving work, and only 30% of that's reimbursed by insurance. Okay, that's got to change, right? But don't say no to something just because healthcare insurance doesn't pay it or because the NIH isn't funding it yet, right? If it works, go after it.
Thank you, and I know I'm the moderator, but I'm going to take a minute to add my 2 cents on this one, if that's okay. But you know, I think what's become evident, and so I've been at Grady about 4 years and had been in the public policy arena for a long time before that, and anything that ends with like education, ION, I was in that space. You know, and I think what I would ask, you're here because you're part of the healthcare industry. Healthcare today is not considered infrastructure, by and large. You know, we talk so much about our roads, we talk about our schools, we talk about our, you know, sanitation and water, and those things are all important. So it's a yes and, right? Like not an either or. But if you look around, if you look at what organizations are focused on, healthcare is not always treated as basic infrastructure for quality of life. And so I would add to getting in the game with helping people understand how you and your organizations are making a difference, how the drugs that you are representing are helping people be healthy so that they can go to work, how the hospitals that you work for are helping mothers be able to go home and take care of their kids. Because of you are already making a difference. Because if people are not healthy, they can't take advantage of any of those other opportunities. They're stuck at home, or they're stuck in a hospital, or they're collecting unemployment, and the cycle's continuing. So I want to say thank you to all of you. You chose to be in this room today. You've chosen to be in the healthcare profession, which is noble and important. I'm going to challenge you to leave here thinking of one thing that you can do over the next week or so, whether within your own organization, you've been thinking about getting involved with the United Way. I mean, think of something you can do, because every little bit really does matter. I want to thank these amazing panelists who work for incredible organizations for giving us their time today. It's been a pleasure to be with you. I want to thank Russ and Mark and everybody at Health Connect South for focusing on philanthropy. It really is important. And hopefully we all come together and we make a difference. Thank you so much.